Hopefully that is okay. Perfect. All right. So, for those of you that don't know me, my name is Nick Dunlap. I'm a licensed professional clinical counselor and also a consultant and trainer for the Coordinated Specialty Care for First Episode Psychosis program here at the Best Center at NEOMED. And I'm going to talk a little bit about program outreach in Coordinated Specialty Care for First Episode Psychosis. And in full disclosure, when I initially decided on this topic for the didactic, I had a different plan for what I was going to talk about and what I was going to discuss. But over the last year, even the last couple of months, the direction of this didactic definitely evolved into an area that I think is more relevant to today. And so I'm hoping that the presentation, the didactic today, will provide some thoughts and some considerations for not only outreach in CSC for FEP, but also how CSC for FEP teams can um, accommodate what could potentially be a product of increasing outreach into the community. So I'm share with you, hopefully. There we go. Here are some of the objectives that we're going to talk about today. And I'm not going to go into a lot of detail about, quote unquote places or where outreach should be completed. I think most CSC for FEP teams are aware of where the common potential referrals may come from. And so I'm not going to go into much detail with that, but as I mentioned earlier, I'm going to talk a little bit about what are some considerations with completing outreach? How can outreach be done? And also talk about what are some of the potential barriers to outreach, and again, what are some potential barriers to the outcomes that may come as a result of completing outreach, both internally and externally, from where the program is located. So just again, we're going to talk about what is the reasoning or the rationale for outreach, right? So CSC for FEP programming is a specialized service. It's a specialized program that exists in community mental health agencies. And the most important rationale, right, is in doing outreach is to increase awareness into the community, right? So that potential referrers um, know about the program and know where to refer individuals that may be appropriate for CSC for FEP services. So starting off and talking a little bit about external outreach, right? So the obvious benefit of external outreach is to establish a referral base, right? So one of the things that I think is a consistent I don't know if challenge is the right word, but it's something that a lot of CSC for FEP programs are confronted with is how to increase enrollment. How can we bring our numbers up? How can we see more people? And so external outreach is a great way to do that, right? So increasing awareness, individuals in the community know to refer for individuals to the CSC for FEP program and the agency with where it's located, but also some other benefits of doing external outreach is promoting education about first episode psychosis, so increasing the knowledge base in the community about that, with hopes that that can help to reduce stigma that may exist in communities with regard to psychosis, and perhaps change some of the mentality that may exist in communities with regard to psychosis. And also, it's a great way to network in the community in understanding not only where CSC for FEP programming is, but also what other programming exists in the community. That so if perhaps a referral comes to the CSC for FEP program, not appropriate for services, But hey, I was just doing outreach at another agency and they had this program. This individual might be really appropriate for that service. And so making the referral that way as well. And then I think whenever you look at CSC for FEP programming and really anything that we talk about from a mental health point of view, from a physical health point of view, right, the consistent evidence is that early intervention can lead to improved outcomes. So that's the big goal with CSC for FEP programming is the sooner that we can help address the gaps. So the delay in individuals seeking services, then that's really what we're talking about big picture is how can we improve the outcomes for those individuals that we serve? And we know that by intervening early, that greatly increases the potential outcome. So internal agency outreach, and this is something that I think is so very important. In given the current issues and challenges that are present in community mental health agencies with regard to turnover, staffing changes, increased programming being available at community mental health agencies. So internal outreach is really, really important to address some of those potential barriers. It's not uncommon for a therapist that's completing an intake assessment to be new and not know about the first episode programming, and so they may not know to refer someone to the program. It also helps to, again, promote general education about the FEP team, about psychosis. Um, you never know. You might be a provider on the team might be completing outreach internally, and someone that's new to the agency wasn't aware of the program, and they're like, "Wow, that sounds like a pretty awesome program. I would like to be a part of that." So it increases the likelihood of potentially gaining providers on the team or gaining staff to help provide with services as well. So we're going to talk a little bit about some considerations for outreach, right? So we're keeping all of the goals and what we hope to accomplish when we do outreach. We need to consider several things, right? And so the ideal, in an ideal situation, our new referrals would equal our new quote unquote discharges. So those individuals that are stepping down from CSC for FEP services, for lack of a better term, should be replaced by new referrals. And so I have questions on here. Is that the reality? And do teams have the capacity or staffing to continue to work with new referrals? Do teams have the agency support and buy-in to address potential capacity staffing shortages on CSC for FEP teams? And so it's important to think about if this is the ideal, as we think about completing outreach both internally and externally to the agency where the FEP program is, it is another opportunity to think about potential step down for those participants that would be appropriate, right? And so I know that all of the Ohio CSC for FEP teams were provided some tools and some guidance with regard to step down and discharge off of the FEP team. And so does present as an opportunity to utilize those tools, those interventions, those different guidances that were provided to look at step down and maybe be able to create more space, if you will, especially for dealing with capacity or staffing concerns within the FEP program. So thinking about the reality, right, and working with several CSE for FEP teams, the fear of increased enrollment without identifying or looking at capacity concerns is a very real fear that teams have. If we complete a lot of outreach and Here's Nick talking about if we do outreach, we're going to get more referrals. How are we possibly going to be able to provide good and ideal services to those individuals when they come into our program? Um, and staffing turnover has an impact on the services that are available. Staffing turnover impacts participant care and engagement, right? So think about those, and we oftentimes lose sight of that. Those individuals that we're working with in CSC for FEP programming, because of turnover that's occurring, they're maybe getting to know their third case manager in a year or their third therapist in a year. And think how frustrating that is for those individuals to have to get to know somebody and build that rapport all over again. And we can talk about, doing warm handoffs and providing introductions, and that is very important, of course, but it doesn't impact the challenge that the participant is experiencing because of having to build that rapport all over, um, perhaps multiple times just since they've been enrolled in the CSC for FEP program. And I've kind of touched on this a little bit, right? So in the current climate of community mental health, the most important consideration in completing outreach is, of course, who has the time and how is it getting paid for, right? And so agencies might look at outreach and increasing awareness in the community as how is this non-revenue generating activity going to be absorbed within the agency? And that is, of course, the million-dollar question. If we could figure out how to do that, um, it would be a lot easier for a lot of CSC for FEP teams to be able to incorporate that. So, in taking this big picture of who has the time and how is it paid for, um, I'm hoping that we can bring to light some potential ways of addressing, particularly those barriers, time and money, because those um, currently are of the utmost significance within agencies where CSC for FEP programming is, but also looking at capacity and potential limitations. So, ways to address some of those barriers. So first and foremost, we have to recognize the reality of capacity and staffing limitations to accommodate new referrals. Because all CSC for FEP teams want to provide good services. They don't want to provide inadequate care and appear to be dismissive. And so some things to think about is considering adaptations to programming. What are some potential services both within the agency where the CSC for FEP program is, and maybe externally? How could those services be incorporated while still keeping the spirit of a collaborative care model like CSC for FEP programming? Considering additional team members or increasing time if possible, right? And so also keeping in mind the potential barrier to that solution, if you will, is that a lot of providers are stretched thin as it is, right? So they may already be involved in many different programs. So keeping that in mind, if we want to explore that as an option, is the provider that would be brought on to help in the CSC for FEP program, are they already stretched pretty thin? Is it going to be difficult for them to accommodate another program as well as the participants that they would be working with as well? Consider advocating with agency leadership to increase support and buy-in. How can the leadership at agencies offer some guidance or some support? And I'm going to touch on this in a little bit, but all of the FEP teams in Ohio, all of the CSC for FEP teams in Ohio receive money to help, particularly with outreach and to cover non-productive and non-revenue generating activities such as completing outreach in the community. And so does agency leadership, are they aware of that? Do they know that that's what the money can be used for to help cover some of that time as well? So thinking about the time and money, with regard to internal outreach in particular, think about what's already done. Providers on CSC for FEP teams probably have, regular staff or agency meetings that occur. So, for example, the if the team has a nurse that is working, that is a provider on the team, they could, do some outreach at the nursing staff meeting that they have. The case manager, the therapist, the peers on the team as well, can all speak up during staff meetings and increase the knowledge of the other case managers, therapists, peers at the agency, of the CSC for FEP program. So um, always think about what's already being done. And this is true externally as well. So emails, social media posts, as outreach can be used to increase awareness in the community. We touched on, program adaptations or program changes with regard to CSC for FEP programming. Emails and social media posts can be excellent with that. So, in particular, if a CSC for FEP program maybe expanded their diagnostic criteria to include affective psychosis, sending an email to already established potential referrals or social media posts to let the community at large know that the program has expanded and has changed, so that it is something that can be incorporated or adopted, can prove to be very valuable. So even with established programs in the community, this type of outreach and awareness can be really, really beneficial. Also thinking about what the agency does already with regard to community awareness. So if there's a community awareness fair or community health fair, that the agency is already going to be represented in some way, shape, or form, um, the team could make sure that the whoever would be quote unquote at the table, at these fairs, for example, they would have some materials regarding the CSC for FEP program. So it's not any particular provider on the team that would need to accommodate or be there. Well, that would be ideal that they could be there. But if it's just not doable, from a larger agency perspective, it materials can still be provided, to the community through these types of awareness fairs or awareness activities. So I know with regard to outreach, didn't talk a lot about where to do outreach. But my hope, as I shared, my hope is to really help everyone that is part of a CSC for FEP team think about what can they do, and how can they hopefully try to address some of those potential challenges that may be present. And so I am all done. I thank everyone for their time. And I'm going to turn it back over to Crystal.